On this edition of Veterans Health Watch, we'll focus on mental health issues and the symptoms, treatment, and coping skills for depression and anxiety. We'll also talk about the recovery care model designed to help veterans manage their mental health. Welcome to Veterans Health Watch, a program sponsored by the Veterans Affairs Maryland healthcare system that provides the latest health and benefits information for Maryland's veterans, their family members, and the local community. I'm Kenya Griffin, and today's show will focus on the mental health services and treatments provided throughout the VA Maryland healthcare system and on the symptoms and recovery for anxiety and depression, two of the most common mental health conditions in our society. Joining us today is Dr. Sarah Redding. Dr. Redding is the director of the Mental Health Clinical Center for the VA Maryland Healthcare System. Dr. Redding, thank you so much for joining us.
Thank you, Kenya.
Let's get started talking about mental health. What do we mean when we say mental health?
Generally speaking, mental health is how we think, feel, and behave. Mental health determines how we adjust to life stresses, how we communicate with each other, and how we make choices. Mental health, like physical health, is important at every stage of life and essential, really, for overall well-being.
And so how does a person know when they have a problem with their mental health?
Right. In its most extreme, it's incredibly clear. So when people are hearing voices when there's no one in the room, or have fears that people are out to get them, patients, veterans, and their loved ones can identify when we are in a place of serious mental illness. There are times when the symptoms are more subtle. It's clear with major depression, it's clear with severe anxiety, but there are times when physical symptoms can be really what the symptom of the mental health issue is. For example, when people are having trouble sleeping, having change in appetite, having decreased motivation or energy. These can all be symptoms associated with mental health problems that they should think about when they're talking to their primary care provider in search of help.
That kind of leads me to my next question. You mentioned the primary care provider, and I know the VA has a great system for veterans to seek mental health care. Could you explain that system a little better for us, and how should a veteran go about seeking care through the VA Maryland healthcare system?
One of the benefits of our system is a program called Primary Care Mental Health Integration. And so this is the kind of program that is not seen in other healthcare settings to the extent that it is in the VA. So in each of our primary care environments, there are mental health professionals working shoulder to shoulder with the primary care doctors. Beyond that, the primary care physicians themselves know how to treat and care for the most clear cut of mental illnesses. And so instead of having to go from the primary care clinic to the mental health clinic, they can be treated in place with dignity and respect, with decreased sense of stigma associated with the mental health symptoms that they may be presenting with. And I think that's the best place to start for most of the veterans seeking our care.
Great. Well, it's good to know that a system is in place to help our veterans. And what about the veterans who are experiencing the serious mental illness issues?
Right. And so, generally speaking, when we talk about serious mental illness, we think about veterans with schizophrenia, major depressive disorder, bipolar affective disorder, PTSD, and some of the addictive disorders. For those veterans and patients, we have kind of a continuum of care that cares for them both in their home, in the outpatient setting, or in the hospital based on what they need.
Can you describe for us the variety of treatment services you have for veterans?
Sure. In the most extreme, for those veterans suffering from life-threatening mental illness, we have the inpatient units. We have an acute inpatient unit at our Baltimore VA Medical Center and what we call a subacute inpatient unit at the Perry Point VA Medical Center. Other kinds of treatments that we have available are absolutely the outpatient clinics. We have outpatient clinics dedicated to the general mental health population as well as specialized treatment for those individuals with PTSD, substance use disorders, and a variety of other complaints, including anxiety disorders. We have programs for individuals with serious mental illness, and we discussed what those were. But for those individuals with SMI, serious mental illness, schizophrenia, major depression, bipolar disorder, PTSD, we have a team called MICM, Mental Health Intensive Case Management Team. And the MICM team will serve a small group of veterans and care for them in their homes, in the community, in a recovery-based setting in which they can reach their highest level of potential of recovery from mental illness. As well, we have psychosocial rehabilitation programs where veterans could come 5 days a week. We have programs that get patients back to work, everything that would allow a patient, a veteran, to reach the maximum capacity of their really life dream in the setting of mental illness. And that's what we're really trying to do in terms of recovery from mental illness, provide all kinds of care across the continuum for each of the veterans.
And I know the VA Maryland healthcare system is a pretty large organization. You have outpatient clinics throughout the state, and you mentioned the Baltimore and Perry Point medical centers. How do you offer treatment to a veteran who can't reach any of those locations for whatever reason, a medical reason or location? How do you provide treatment for that veteran?
Sure. The VA Maryland healthcare system does span across the state. And there are veterans who can't easily get to one of the community-based outpatient clinics, the CBOCs, or to one of the bigger medical centers. And so we're really on the cutting edge at the VA in terms of what we're doing with telemental health and telehealth in general. Increasingly, we are putting cameras in the homes of veterans who can't, for even symptomatic reasons, get out of their home and get to the clinic, and providing that care from a clinician in their office to the patient in their home. We're just starting that here at VA Maryland, but I think it's really got great potential in terms of serving the veteran where they are and trying to treat them kind of in sight so that we take away the anxiety or the difficulty with them needing to get to a clinic.
And I know that the VA also has special populations. You have women, you have homeless veterans. Is the mental health treatment program also designed for those special populations? What types of treatment do you offer for those people?
Interesting, and so that every veteran has an individualized treatment plan, and so we think about patient-centered care. But for those individuals who present to us with kind of myriad other symptoms, we have a specialized program for women veteran, an emerging population in our new areas of conflict, and we love seeing them as part of our patient population, being able to treat them with sort of specialized services dedicated to how they may present differently with major depression, for example. So for every population, the VA has something to offer, and it will depend on what the veteran comes to us with, that we will manage their care based on the needs that they have.
Dr. Redding, thank you for getting us started on this conversation. We're going to take a short break, but could you tell veterans and our viewing audience how they can learn more about VA mental health care services?
Sure. The best place to start is by talking to their primary care provider, and if not enrolled, please enroll into the VA Maryland healthcare system. The primary care provider is a great avenue into the mental health services, either through the primary care mental health integration or through a consultation to the mental health clinic. Or they can just call the mental health clinic at either the Perry Point or the Baltimore VA Medical Center.
Thank you again, Dr. Redding, for joining us and starting us off on this conversation about mental health. We're going to take a short break, but when we return, we'll have more about anxiety and depression, so please stay tuned.
Did you know that Department of Veterans Affairs provides physical and mental health care for over 8 million veterans? Hi, I'm Natalie Dell. I may be an Olympic medal winner, but I know that real champions are those who have served this country, and VA knows that too. As a VA employee, I've seen the challenges our veterans face. I'm honored to be part of a team that supports veterans in achieving fuller, richer lives, and I invite you to join us in this rewarding experience. If you're a mental health provider, I urge you to visit vacareers.va.gov.
A lot of women veterans don't realize that the VA is here to take care of them. They served and they deserve the best health care that there is. The Women Veterans Program has been redesigned to meet the needs of the women veterans.
Female veterans receive just as good a care as men because they're focused more on us now.
We want them to come here, we want them to feel welcomed, and we want them to know that we are capable and willing to take care of them.
Welcome back to Veterans Health Watch. Joining us now is Dr. Erin Jacoby, the Deputy Director of the Mental Health Clinical Center at the Baltimore VA Medical Center. Dr. Jacoby, thank you so much for joining us.
Thanks very much for having me today.
In our previous segment, we discussed overall the treatment services available for veterans with mental health disorders. But now we want to focus more on anxiety and depression. So can you describe those two disorders for us and how they relate, if they do, to each other?
Sure. I'll start with anxiety. Anxiety is the anticipation of a future threat. It involves fear, which is an emotional response. Anxiety is common. You know, most people experience anxiety over an assortment of things in their lives. Depression is a mood state, usually involves sadness and despair. It can actually present as hostility or irritability as well. So anxiety and depression are related experiences for individuals, and they're common experiences. When they become problematic and they start to impact your functioning, that's when we start to consider them as disorders.
Dr. Jacoby, you mentioned that anxiety can be a common emotion. When does it become unhealthy?
Well, anxiety and depression can impact the way that we function in our active daily life. Once it starts to impact our concentration, our memory, when it starts to impact what we do in our life and what we don't do in our lives, that's when it becomes problematic.
And are there different stages or different types of anxiety disorders or anxiety conditions, I should say?
There are. I think most commonly people think of phobias. You know, if you talk to anybody on the street, phobias can be for anything specific to having difficulties riding in an elevator, sometimes fearing certain types of animals like cats or dogs. Other people can have phobias of specific conditions like flying on an airplane. Aside from phobias, people can experience something specifically called social phobia, which is literally a condition where you fear being scrutinized or criticized by people in society, so it's very difficult to interact with individuals. There's also something called agoraphobia, which is really the fear of kind of open spaces. Individuals with agoraphobia sometimes have difficulties actually getting out of their home. They worry if they go out of their home that something bad will happen to them, so they just stay inside. And then in addition to agoraphobia, there are panic attacks that people can experience, which are really the foundation of what we call panic disorder. If you've ever had a panic attack, it actually feels like you're dying. Many people who experience panic attacks have shortness of breath, their heart races, they begin to sweat profusely, and they usually present to the ER thinking that they're having a heart attack, to only learn later that it's actually anxiety that's driving their symptoms. Lastly, sometimes people experience a generalized sense of anxiety, something that we call generalized anxiety disorder. And that's literally being anxious, worrying about a whole host of things. It can be very incapacitating, however, where people can totally change their routine, the way that they approach the world to navigate and get around such feelings.
And we'll get to the treatment for those different conditions. But what about depression? Do we have the same several layers of depression?
We do. There's two primary depressive disorders. The first is something that Dr. Redding had spoken about earlier, something called major depressive disorder. Sometimes people refer to that as clinical depression. It is a very serious condition that often impacts people's mood, sometimes can actually lead people to feeling suicidal, where they start to consider ways to end their life when they're so depressed. There's another type of depressive disorder, it's called persistent depressive disorder or dysthymic disorder. That's a lower grade condition. It's a longer term condition that actually lasts for a lot longer. Clinical depression usually lasts for an episode, at least 2 weeks, and usually resolves after a month or two, whereas the dysthymic disorder can actually be something that's present ongoing in people's lives. The new Diagnostic and Statistical Manual has also included some other depressive disorders. You might have heard of bipolar disorder, which is sometimes referred to as manic depression. That's a condition that people experience both increased energy, sleeplessness, agitation, and sometimes it can get as bad as they start to hallucinate, coupled with significant deep depressions where there's often suicidal ideation present.
And are some people more prone to experiencing anxiety or depression? And what makes them more prone?
Definitely. We always view mental illness as really the intersection of genetic heritability. So certainly if you have family members who have a history of either depression or anxiety, you're at greater risk for developing those types of conditions. Plus the life stressors that we experience, as well as just your basic temperament, who you are and how you rebound and are resilient to certain things. So it's really that three factor model that we think about: genetics, stressors, plus temperament, that really results in people's symptoms. There are specific events in people's lives that can really alter their symptoms. Sometimes people experience trauma, and if you've had any type of trauma in your past, you're at much greater risk for developing depression and anxiety. The other piece that we always think about is substance use. There are substances that you can take that actually induce depression or anxiety states that can be very serious.
And let's get into the treatment now, with the treatment services that are offered throughout the VA for anxiety and depression. Can you tell us a little about that?
Definitely. One of the things that we're really proud of at the VA Maryland healthcare system is that we use recovery-based care. We really try to take the veteran and his or her goals into heart when we're developing treatments. What we know is the gold standard for treating either depression or anxiety involves the combination of pharmacotherapy or medications plus talk therapy or psychotherapy. And we have evidence-based approaches in both of those. Typically, we would use a selective serotonin reuptake inhibitor, or an SSRI, for treating either anxiety or depression. And we combine that with either cognitive therapy or interpersonal therapy to help augment the benefits that we receive from those medications.
And how should a veteran seek immediate attention for anxiety or depression?
Well, as Dr. Redding pointed out earlier, we have an excellent partnership with our primary care physicians in the VA Maryland healthcare system. And so a veteran can talk to their primary care physician about the concerns that they have. And we actually have embedded mental health staff that are in the primary care that can do on-the-spot evaluations if the veteran needs somebody else to talk to. In cases where the conditions might not be managed in primary care, we also have the mental health clinic, both at Perry Point and in Baltimore, as well as evidence-based specialty care in some of our higher intensity programs.
Are these walk-in clinics at Baltimore?
We do indeed have walk-in clinics in both Baltimore and at Perry Point. They're located embedded in the mental health clinics, and they're staffed by licensed independent providers who can provide those services. Very
good to know. Dr. Jacoby, thank you so much for being here with us today and sharing this important information. We're going to take a short break, but when we return, we'll talk about the VA Maryland healthcare system's recovery model for mental health treatment, so please stay tuned.
I did not know where to turn, and I called the hotline, and they really helped me. I was in a very dark place.
My family called for me. I did not realize that I needed help, but I'm glad they called. I'm doing so much better now. I'm working again.
The hotline staff was very supportive, and it connected me to a program at my local VA.
The suicide prevention team helps me when I need refills of my medication or need an appointment quickly with my doctor.
I thought that I would feel uncomfortable talking about my PTSD with a therapist, but it has helped me live a better life.
The suicide prevention team sends cards to me each month to check on me. That makes me feel special.
I was depressed and had relapsed, and the VA provided me with good mental health and drug treatment. I have now been clean and sober for 18 months.
It does take courage to ask for help, but once you do, you will get the help and support you need to feel better. It worked for me.
Welcome back to Veterans Health Watch. The VA Maryland healthcare system has been working hard to promote a recovery-oriented model of care for mental health care services. And joining us to discuss this new model is Dr. Jason Peer. Dr. Peer is the recovery coordinator at the VA Maryland healthcare system. Thank you for joining us.
Yeah, sure.
So Dr. Peer, tell us a little bit more about recovery-oriented care. What does it look like?
Okay. It's a transformation that's been occurring in the mental health system over the past 20 years, but primarily in the past 10, I'd say, as a result of the new Freedom Commission, which came out in 2003. And really, it's very consistent with patient-centered care, and it's focused on instead of treating disease or symptoms, we're really trying to think about recovery as a process, and it's focused on helping people get back into their life and living the life in the way that they want to. So that means that we're, as Dr. Jacoby was mentioning, we organize care around veterans' goals and what they want to achieve and how they want to achieve that, and we try and tailor care to do that for them.
So what does it look like to the veteran?
The veteran is, it's going to look much more like a partnership or a collaboration.
And what is the VA doing to promote the recovery care model?
So there are several things. You know, the local recovery coordinator, my position, is something that all VAs have. That's my job is to promote recovery-oriented care, provide education and information, do things like this. But there's been several other initiatives. One of the kind of flagship recovery programs in the VA is the Psychosocial Rehabilitation Recovery Center. This is a program that's really focused on helping veterans achieve the goals, and it's designed for veterans with more serious mental illness, but achieve the goals that are important to them and get back into the community. Another more recent initiative has been the implementation of peer support and the hiring of peer support specialists across the VA. So these are veterans that have the lived experience of having a mental health condition, but then successfully managing it. And over the past year, the VA nationwide has hired over 900 peer specialists in the VAMHCS. Right now we have 11. And so these are folks that work on mental health treatment teams as a part of the treatment team, but they can connect with veterans and offer hope.
And you mentioned that the goal is to help the veterans to not be patients anymore, to reach their goals.
Right.
So how can the veteran tell, how can a clinician tell when they're actually recovering?
Sure. So, I think one big way is that veterans, depending where veterans are in the process of recovery. So when veterans start to identify goals other than being a patient, goals that include returning to the community, that's sort of one sign. When veterans are more active in their care and expressing preferences and saying, this is what I want, this is what works for me, this doesn't work so well for me. I think that's another sign. And then ultimately kind of having people be able to think, our veterans identify that there is something beyond coming to the hospital, that there is more to life than just this. All would be in indications that sort of recovery is happening. Yeah.
Excellent. And joining us to share his story is Mr. Howard Turner, a Marine veteran. You're going to share your story about the recovery process and how it's worked for you. But first, can you talk to us about your military service? What made you join the Marines, and in what capacity did you serve?
I just felt the need to serve my country. And it started out as just, honestly, a way to get away from my dad. We didn't get along too good at first, and I was very satisfied with when I joined the Corps. I served in motor transport. It was a 35-31 for anybody that knows what that is in the service. Operated various types of vehicles, heavy equipment, things of that nature. and I was quite happy with my ability to operate this different machinery and learn about it.
And we were chatting earlier, and you're a Vietnam era veteran, like my dad. So could you tell us what has happened in your life since leaving the military?
Since leaving the military, I started my own business. I managed that quite successfully for a number of years. I'm engaged to get married, and I have a new granddaughter. She's 3 years old, and I'm very proud of her. I'm very proud that she's here and that she's in my life. So,
well, congratulations. Tell us a little bit more about your recovery journey and how the VA Maryland healthcare system has helped you using this process.
It's been an immense help. After the loss of my father, it really set me back physically, mentally, emotionally, and I was basically lost. I didn't have a direction. And since I've been in the program here at Perry Point, they've given me much knowledge and information, guidance, and assistance with things. And I have a new approach at how I assess these things and deal with them, whereas before I couldn't tell you left from right. So.
And how has the program helped you set goals and achieve some of those goals?
I just want my life back like it was when I was, quote, normal. You know, I want things back like I want my own business back again. I want to have another home and be successful at most things that I used to be successful at. And with the tools that they've given me, I can foresee that coming. It's an ongoing process, and I'm just getting started at it, but I can see some of the results already.
That's great, and Dr. Pierre mentioned at least seeing those goals as a step toward recovery. That's awesome. And so what would you say to a veteran who is noticing that he or she is having some difficulties with mental health issues or the mental health condition, and maybe they haven't reached out for treatment yet? What would you say to that veteran?
I would highly advise them to seek some help. It's there, and it does work. You need to stay open-minded, try and maintain a positive attitude, and above all, be curious. Explore what's being offered to you. The answers are there. You just have to want to get them.
Couldn't say it better myself. So Dr. Pierre, do you have anything else you would like to offer for our veterans who are looking for assistance or seeking treatment about the recovery process?
Well, I would just, you know, if you've been away from care because you had a bad experience, I'd encourage you to give it a try again. I think as Howard pointed out, there's a lot of resources and folks that care about you and helping you get back to what you want to do and back to your life.
Mr. Turner, thank you for sharing your story with us.
Thank you.
And Dr. Pierre, thank you for sharing your expertise.
Sure, thanks.
That wraps up this edition of Veterans Health Watch. If you have questions about today's show or would like to make suggestions for future topics, please call us at 1-800-463-6295, extension 7101, or you can visit us on the web at maryland.va.gov or join us on Facebook or Twitter. And remember, if you are a veteran or you know a veteran who is not receiving care at the VA Maryland healthcare system, please stop by one of our medical centers or outpatient clinics, visit us on the web, or give us a call. We'd love to serve you.
If a veteran is experiencing any type of mental health problems, they should realize that they're not alone.
One of the things that we can really help with is kind of giving them the education to help them face the issues.
Hiding and keeping secrets was the very thing that was keeping me sicker.
Trust me, you're not by yourself. If no more than to know that I'm in that same category.
Saved my marriage, made me feel like a person again.
I couldn't have gotten this far without the VA.